Hi everybody. So this is my video reflection for physician-assisted suicide, the group project that just happened this previous week. I found it very interesting that the entire group covered this topic because I believe it is something that is very important to talk about with a focus on public health and the medical policies that are set in place right now in our country. We're a lot more, I think, conservative and that light compared to what other countries are doing currently with it. I say this because I really didn't know a lot about what physician-assisted suicide was before I took my healthcare ethics class, which was last fall. We learned a lot and we covered a lot of the policies that like Covenant Hospital set. We learned about Ascension of St. Mary's and things like that. And I even looked into my own local hospital's policies, and I found it very interesting how each of them kind of varied depending on the practice and depending on their own procedures. Um, we learned about several different cases specifically in that class that were very controversial and that were very historic with setting the policy that we have now for physician-assisted suicide. I really sort of knew that was focused towards patients that chose, once they are on that path of like coming to the ending stages of their life, that they can choose to proceed with asking doctors for consent prescription for physician-assisted death. Looking at since learning about it, I think there are only certain situations where I would approve of a patient who is in need of this. Looking at it in like the medical provider aspect, but as like a family member aspect, I think if it was to the point where I knew that they were in a great deal of pain and they were towards a stage in their life that they never knew that they would be, I think I would absolutely want them to have that choice, but to be as well informed as humanly possible. I think that's the biggest thing, especially when looking at all the different cases that we did. Some of them were not completely informed. Some of them were. Some of the family members weren't. Some of the family members were. So I would want more clarification, I think, with looking at that. I don't want to think that I would be allowed within needing a doctor's prescription or a note to get it. I would hope that they can be, I don't even know how it would like happen without that, but I feel like a provider should exhaust all possible options and alternatives before just resulting to that. Because I think there are so many beneficial alternative therapies that can help with pain management and pain control at the end of life that I've seen with my own family members that I know has helped a lot. And that kind of gave a sense of comfort to the rest of the family too, because we felt like we were equally involved with it. And I don't know as though if with a physician-assisted suicide or death that there would just be a very independent-minded medical treatment, if that makes sense. I feel like that's kind of the toss-up and some of the ethical dilemmas that we face with it right now. And I haven't heard a case yet where that would happen, but I still feel like some patients could do that, to where it would be that they might manipulate their own health in some ways to compromise like the ethics behind the procedure just because they didn't know what else to do. Or maybe it would be the case that they couldn't have those options. They couldn't have all those alternative options that some of us are able to have or have seen with our own family members. What I didn't realize or may have forgotten since my class is that there's a turnover period. Rachel kind of like opened up my eyes a little bit, and I was like, okay, wasn't entirely aware that that happened, but maybe it was just my own brain with everything going on right now that I totally forgot about that. I didn't remember that with regard to patient's choice to this procedure, that they have that turnover period and that they can choose to kind of withdraw like the need for the procedure. I thought that was very interesting to learn. What's kind of surprising to me is that there are still states that approve of physician-assisted death, but there are only a few where it seems like it's socially accepted, I guess is the way I want to phrase it. It's a lot of on the East Coast and the West Coast where a lot of that has happened. I know that, sorry, here's waiting out right now. I know that Angie touched a little bit on like where it kind of originated in the United States, so in Oregon mostly. So I thought that was very interesting to see that wasn't completely accepted around the United States. I feel like that's where a lot of the divide comes from and a lot of the issue pulls from, because I think each kind of state has its own way of determining what physician-assisted death might look like. So I thought that was very interesting as well. I haven't heard of really an increase in cases since the states approved it. I tried to do a little bit of research and there wasn't a huge turnover as far as increase or decrease in the number of procedures and the number of prescriptions. I could see that certain states might not approve of it because of the ethical theory, like I said, behind physician-assisted death, and in other reasons I could see patients not being in complete need in certain states of the procedure. Only because, like I said, certain states are unhealthier than other states, so I could see them using a lot more alternative therapies and a lot more different ways of managing their pain. When looking at most of the states that did approve of the physician-assisted death, I saw a majority of them were on the coastlines, like I said, staggering with the statistics that Rachel gave about the number of people who are prescribed and died from the medical procedure was very interesting to me as well. I agree with the point that Rachel made about people are choosing to use this procedure as a choice from people who are also looking at it in the case of people with the end-of-life care. So I could understand totally with someone who's going through a huge, huge cancer decision, and it's maybe their second or third time fighting this cancer, or maybe if it was a malignancy in a brain tumor or something like that, I can understand about. It's the other issues that I do find, I don't want to say preventable, but manageable, that I would have an issue with it personally, because I feel like, again, our health is a choice. In some circumstances, I know it's not always a choice, but I feel like our health is first and foremost our choice. So we need to look at our health and our bodies as a choice to take care of. You know, sometimes I know it's genetics, and sometimes I know it's hereditary, or it's the environment, or socioeconomic factors, or social determinants, and I understand that, but I think overall, in fact, it is our choice to take care of our own bodies, and we need to be consistent with understanding it and knowing how those things can affect our bodies. So I think that's a huge thing to have when you're looking at this kind of procedure as well. One other thing that I thought was really interesting was Haley's CNN video. This man making a testimonial talking about how he had to go through it with his dad. I believe the judge's name was Neil Gorsuch. I think that's how you pronounce it, but I'm not entirely sure. I thought it was kind of ironic how he brought it up. I'm curious as to like what his actual story or interactions with this kind of issue is. I know I've never personally been affected by somebody who's had to or wanted to ask for a physician-assisted death, but I've had classmates that have talked about that. That was one of the things that we talked about in our health ethics class, is that we had some classmates who had unique family issues that chose to go through that procedure, and they talked about it a lot more from the outsider's perspective of like seeing what that patient is going through, which I thought was very eye-opening and interesting, because you don't always sometimes think of that. You sometimes just look at what the medical provider is doing, and you look at what the patient's doing through this entire procedure. You don't look at the outside factors of how that person has affected their family and their friends and their community in a different way. So I thought that was very interesting. I think it's also something that you wouldn't typically hear from a politician in our time, what he was saying, and I don't know if that's because of the reaction that he was trying to get from the committee. I think there's a lot of stigma behind physician-assisted death. That's one thing that I know I definitely had when I first learned about it. I thought it was kind of like, I don't want to say an easy way out, because it's never an easy way out, and you never want to see somebody struggle. I know I went through that personally with seeing my grandparents die. It wasn't always the most comfortable situation, I guess, to interact with. So it was kind of interesting to me that he kind of scratched the surface a little bit and talked about that, but I think there's a greater need for that today with the changes in healthcare that we will be seeing to kind of be vulnerable, but I could also see it where it could be a political ploy that he would use that. The video went into more detail about the center's book, and one quote in particular that I brought back from it was, "All human beings are intrinsically valuable, and the intentional taking of human life by private persons is always wrong." That I thought was kind of interesting, because I look at it and I feel like that could then be applied to so many different situations. It could be about homicide, it could be about murder, it could be about DUIs and drunk driving and accidents and things like that. So I thought it was kind of interesting that that was something that personally stuck with me because I feel like that could be applied then to so many different other cases where, you know, we do have procedures in place and we do have laws set in place and we have a lot more evidence that we can base it off on and how that's reacted or how that's been approached by politicians and lawmakers. So I thought that was very interesting as well. Going into more detail, the reflection by Matt Fairchild and causing him to choose to fight it, but also all the medications that he had was mind-boggling to me. I mean, I've seen with my own grandparents, you know, in the last 2 years, we've had to do a medication reassessment to see like what is something that they need to change or what's the dosage that they need to change or do they need to be pulled off of that. I thought it was absolutely staggering how much he had to take. I don't know if I could ever do that, and I hope I never have to do that, but I thought that was ridiculous as well, especially considering pharmaceutical costs right now and where that industry is going. I could not imagine having to pay for all those. It's probably extremely expensive. So he is resentful, I think, about receiving the disease that he did and getting it, and he was inspired by Brittany Maynard. I know he talked about that a little bit during his interview, but I thought, again, it was a crazy situation that could happen, honestly, to anybody. He was somebody who was so healthy at one point, and all of a sudden he had this, and just seeing what it's done to him, you can tell it's very, very disheartening because it's broken down his confidence a lot. So I thought that was very interesting to pull out from the CNN video that Haley showed. One statistic that I also had that I thought was interesting was 68% of the country is in favor of physician-assisted suicide. I thought that was really interesting because, again, it's a topic that we don't typically talk a lot in, you know, public society. It's not something that's overly well known, I think. But I find it interesting that given that, there's still a greater majority of people who are in favor of it. And I wonder, going back to, you know, the whole situation behind like cancer patients or patients with a brain tumor or situations like that, where it could be a very healthy alternative to struggling. I know me personally, I have 2 cousins right now who have an orphan disease. It's called MPS 3. Basically what it does is it takes our body's sugars and know how we normally recycle them through our kidneys, and their sugars don't recycle. So that leads to enlargements of different organs. It leads to neuromuscular dysfunction and deterioration. And the average life expectancy is between 18 and 20 years old. So one of my cousins is 19 now. He just turned 19 in December, and Caleb is 14, I believe, 14, 15, something like that. Caleb's just that hormonal teenager that we just kind of like let him have his fits. But they are, I think, that kind of scenario where Jared's at the point, he's the older one, where he can't really communicate in full sentences. So he's not able to tell his mom and dad that I am in pain. And through puberty especially, we realized as a family, like, it was a very hard struggle because they were, you know, getting growing pains and they were understanding like their bodies are changing. And they can't express that. So I could see maybe in that situation, because of how much it will deteriorate their muscle function and neuro functions. I would hope that they wouldn't struggle, that they could die peacefully. I know that sounds morbid, but it's kind of coming to that point where we as a family are starting to realize like things aren't getting easier. I know Jared's been struggling a lot lately with having seizures and stuff like that. So I feel like in that kind of situation too, I would want a practice in place so that he isn't struggling and that he can go from this world peacefully and relaxed and calm and be with his family. Because I know sometimes that's not always easy for him to communicate. I know sometimes he's very hypersensitive too. So I feel like in those certain situations too, even with maybe, I don't know if it'd be the same procedure with like an autistic child who maybe develops a brain tumor or something like that, if that would be something where our lawmakers and our medical professionals would encourage a physician-assisted death, or if they would discourage that. I don't know how that would work. But I would be in favor, I think, of something like that.